to make it, let's see. If you know how you see someone smile and you're like, oh, I wish I could fix that. Now, while I'm not into orthodontics or things of that nature, I am in a position, or I chose the position to maybe direct someone into getting the care and help that they need to have a better smile or a healthier smile. Does that make sense?
Oh, yeah, totally. That totally makes sense. I mean, I'm going to tell you this much. When I was a child, every 6 months or so, I had the parents, as I was growing up, that, every 6 months, around about the 6-month mark, they were dragging me to the dentist. Kind of like every year, they were dragging me to the doctor for a physical and everything else like that. And it was like excruciating just leading up to it. And when I would get there, it wouldn't be that bad. I mean, and I guess this is a model story where, hey, I took care of my teeth, and, my parents made me take care of my teeth and brushing multiple times a day and flossing. But I'm going to tell you this much. As a preteen, no one wants to hear that. You just want to sit there and eat candy and gum and carry on. But every once in a while, you see that child, or you see someone that you're outside playing with, and you look inside their mouth, and you're like, oh, my God, what happened?
Yeah. Well, your parents did do a good thing. Children, within 6 months of cutting their first tooth, they should be at the dentist. Now, some people who are not aware of why that is, it's number one, to make sure that everything's aligning correctly in the child's mouth, even though it's only going to be 2 teeth with that first eruption. But then secondly, it's also to put the child at ease, because there are so many people that are afraid of dental care. And so in starting early with your child, taking them to that visit and keeping that up every 6 months, it makes them familiar with this aspect of medicine. It's something that they need to do. Oral health is health. Without it,
You're so right, Julie, because oral health is health. Because I've noticed as I've grown older, so my hygienist has mentioned to me, you have a lot of calcium buildup on your teeth. So guess what? Instead of 6 months, I want you in here, 4.5 to 5 months. So let's see if we can, combat this issue. And it's kind of, it was slightly unnerving, because I'm going to tell you, for one, when I go to the dentist nowadays, now that I'm in my 40s and a dad, and I'm kind of, grimacing as I'm under, my hygienist pad is pulling and poking and prodding and scraping and all the above. And I'm like, okay, so this calcium buildup or type of, whatever they're telling me that I have. I mean, when you say when you hear calcium buildup, what do you think? Like, what first comes to mind with you being in this profession?
Well, okay, it would be calculus. Is it calculus that she said?
Maybe she did say calculus and not calcium.
Yes, calculus. Some people, calculus is basically tartar.
Okay.
Calculus is just a medical term for it. And some people will have a buildup faster than others. Some people acquire that in their mouth faster than others. So by her asking you to come in more frequently, it's just helping so that you don't accumulate so much. In the 6 month time, for regular people, they have a certain amount. Even with brushing and flossing, you're going to have a certain amount. But there are other people that accumulate it more rapidly. And that doesn't mean there's something wrong with you. It's just that for maybe you and others, you just accumulate the calculus faster.
All right. I mean,
so therefore, just to have it removed.
Okay. I'm okay with that. But here's the situation. So my insurance covers me for 2 visits per year. Okay.
Okay.
At this rate, my hygienist is telling me come in every 4 months. So that leads to 3 visits per year. Let's just say if we're dealing with someone, and yes, I'm blessed. I'm working, and I have health coverage. Let's say, what happens to those folks that don't have dental coverage? Or let's just say they're working and they decided to opt out of the dental coverage. I mean, what's to happen to folks like that?
Well, sometimes the dentist can ask the insurance company for coverage for it's a necessity. So you're not just a normal patient, or the person that happens to is not just a normal every 6 months patient. Their care needs more frequent visits. So some insurances would cover it when it's like prescribed in that manner. But overall, if you don't have insurance, then there's clinics like the one at Briarcliff. They offer the same thing that your hygienist would offer you, having you come in more frequently, which is the cleaning. And that's the services that we offer at our school.
Wait a minute. I got to stop you here, Julie, because you're telling me that there's something called there's free dental care. And yes. This is something that I didn't know anything about until about maybe a week and a week and a half ago. And I was really amazed by it. And I the work that not just your clinic is doing, but I know there's going to be a couple of other neighboring clinics that are that have a similar program. I actually had to put it up on Late Night Parents and I put it up there as free dental care. Free dental care, dental hygiene clinic, because we hit upon something here, and I'm not sure how many other folks are actually offering something like this. So, I mean, I guess give me the lowdown on it. I mean, the blog is one thing, but hearing from someone like yourself is something else, because I mean, this is a real serious issue, but you guys and your company, your school is combating it a different way. So you're offering free dental care. What's behind all of this?
Okay, well, I can speak for the Briarcliff College Dental Hygiene Clinic, but I will touch on the neighboring schools, which would be Stony Brook, NYU, pretty much anyone, anywhere in the country. Go and check out the dental schools, because there are students there that are going to need patients to work on. After they've learned to a certain level, they need to apply that knowledge to actual people in the community. So that's my answer there for partners, where to find these free dental care clinics besides my own. But I can tell you at my clinic at Briarcliff, we offer the medical and dental history with vital signs, because I'm not sure about you or anyone else, but when you go and see your hygienist, that's still an extension of the doctor, medical. You should have your blood pressure taken. Many people don't even know that they have hypertension, but in that instance right there, you can find out how your blood pressure is and then proceed.
I've got to jump in here again, Julie. So what you're telling me is when I go and get my teeth cleaned,
yes,
the doctor, the hygienist, or whomever should be checking my blood pressure?
She should be checked, or she or he should be
checking. He or she should be checking my blood pressure. So so I guess you have to connect the dots for me, because I'm not understanding what you're talking about here. Why would they be checking my blood pressure?
They need to know that there's nothing else going on, that they could proceed further with the care for your oral services. Like I said, hypertension is something that people don't know that they have. And in that instance of checking your blood pressure, many people have been found to have hypertension. It's just an extension of medical. This is a medical, like going to your regular MD. The dentist is not an MD, but still they practice a certain medicine, and that is part of it. If you have blood pressure that is 180 over 110, you can't be seen. You need to be in the hospital. There's been people, or there have been people that have had high blood pressure as such, and they had to stop services immediately and call the ambulance and send them right out to the hospital. Something's wrong. That's why we cannot proceed. And unfortunately, I've been in many dental offices, and the hygiene care was not a part of that. That's something that they don't do anymore.
So Julie, I gotta jump in here, and I'm sorry because I gotta say, was that a standard, or was that not a standard, or is it? I mean, what's your take on that?
It's a definite standard. It's a standard in school, a definite. But unfortunately, certain practices will deem what is going to be done in their practice or not.
Okay.
I am a New Yorker, and I've gone to the dentist like you. My mother dragged me, thankfully.
Yeah.
And when I left, I moved to North Carolina for a little bit, and I went to at least 3 different dentists in the 13 years that I lived there. And my first time, I couldn't believe that she was taking my pressure, and then let alone also giving me what I would say would be a massage. But the massage was really an oral screening. That's something, oral cancer screening, I'm sorry. That's another thing that is nixed out. The oral cancer screening is checking all your lymph nodes to make sure that they are not palpable, indicating cancer or some other infection of some sort. Pretty much like, for an example, like Celine Dion's husband, let's say, he just all of a sudden realized that there was a swelling in his neck. Now, I can't speak for what the frequency of his dental care was, but that's something that you would catch in the dental office every 6 months. Generally, your lymph nodes are not going to swell like overnight. So the oral cancer screening is very important.
I'm telling you, you were taking me to school right now. I'm serious because, so let's say this. Let's say, and you got to walk me through this process. So, I currently don't have dental coverage. I'm Ted Hicks. I currently don't have dental coverage, and I happen to be in the Medford Patchogue area. And I see, oh, hey, Briarcliff College. You know what? I saw a blog on Late Night Parents, and it said that I can go get my teeth cleaned or get checked up or have my teeth whitened or the various related services that you offer. And I walk in the door, and I said, I'm looking for Julie, number 91 from Unit 4. What happens?
Okay, first I would tell you you should make an appointment because generally there's not that many open slots. So just to save you the trip and you actually know you are going to get service, you should make an appointment at the clinic. And you can do that by calling area code 631-730-7211.
Oh, okay.
Yeah.
So let's just say I decided to follow the protocol. I call the number, and I get there, and I'm not trying to be funny, but I show up, and you see that I don't have any teeth in my mouth, or I'm missing a few teeth in the upper or lower quadrant. And I say, hey, could I get replacements, or can I'm not sure of the actual technical term. Tell me, like, a service, would a service like that be offered, or just if you could briefly go into some of the services that are being offered at the Briarcliff College Dental Hygiene Clinic?
Okay. Well, like I said before, it's medical and dental history with the vital sign. You're going to get the oral cancer screening, periodontal treatment, which for someone who may be edentulous, which means missing teeth, or someone with diabetes, they may have poor gum health, or most likely because of the disease. Someone who smokes, they may have gums that need treatment. You're going to get intraoral or extraoral x-rays for free, which you can get a copy of and take it to your primary dentist. We also give sealants. Those help protect the fissures or grooves of the teeth. Then there's the coronal polishing and fluoride therapy. So all of those things we offer free. If you need filling, if you need replacement of missing teeth, those are things that our clinic would give you a referral for to take to either your primary dentist, or we can refer you to a dentist.
Okay. So I see the related services. I'm really impressed by it. Tell me this much. Now, let's just say I'm Ted Hicks, who's used to going to Baldwin Dental in Baldwin, Long Island, and I happen to step into the Patchogue Medford area and go to Briarcliff's dental hygiene clinic. Are there any differences in the experience?
The difference is going to be, number one, because it is a school, everything has to be done right. Everything is going to be double checked. I can't speak for Baldwin in the sense of what A through Z checkoff they're going to do. Everything is going to be complete. T's crossed, I's dotted at the Briarcliff Clinic. So there's dentists right there alongside us that are going over our work as well.
At Dumb Cats created this unsolicited jingle for Popeyes, and it got us dancing. Chicken sandwiches, chicken sandwiches, chicken sandwiches. I want my chicken sandwiches. I went to Popeyes because I needed chicken sandwiches. I read on Twitter that it has lots of advantages. At Dumb Cats from Los Angeles, California, on August 25th at 3:55 p.m. Love that chicken from Popeyes. Love that chicken from Popeyes.
Oh, okay. So I see some of the benefits. We talked about the partnerships. We talked about why this service is being offered. So I guess my question is, Briarcliff is doing it. You mentioned Stony Brook and NYU. Are you guys doing this in conjunction, or is it kind of like standoff one by one programs?
It's separate.
How does that work? Oh, okay.
It's separate. Briarcliff, their dental program is just the hygiene program. At Stony Brook and NYU, you're going to have, well, let's go with Stony Brook first. That's the dental, like a dentist. That's what program they have there. So they do have a dental clinic. And then NYU has both the dental clinic and they have hygienists there, but they will do it in combination. The hygienist will do what I do first, and then the student dentist will come in behind them and assess as only a dentist can pass a hygienist.
Wow. Okay. So, I mean, I guess the best ways to get this, I mean, the great thing about this program is, so would you consider it like a pilot? Because it's running for about 6 months, roughly, about 6 months.
It'll be ongoing. It's just the dates and the times that we're given will change. That's why it's only listed as such for that short period of time.
Oh, okay.
So this is,
go ahead.
I'm sorry. So this is going to be for the duration as long as that is in existence, that program.
Wow. Excellent. Excellent.
Yeah.
Well, yeah, I want to commend you and Briarcliff College for a job well done. You know, the fact that you guys are doing this, you know, 3 days a week, you know, through various hours, and it's, you know, free of charge for folks. You gave the number earlier, it's 631-730-7211. Briarcliff College, the Dental Hygiene Clinic, 225 West Main Street in Patchogue, New York. I mean, I'm just really, really, really impressed, and I definitely want to say thank you for joining Late Night Parents tonight, and we wish you nothing but success. But the best thing about it is we're going to probably, you know, check in with the dentist every, you know, 6 months or so to see how the program is progressing and any other things that are happening. Well, Julie, we want to say thank you so much.
Sounds good. Thank you too.
All right. And that's Julie from Briarcliff College, from the Dental Hygiene Clinic. And